You heard our reporter there describing a tent hospital set up to deal with a surge in cases. We have the biggest one-day death toll so far from this in the U.S., 575 dead. For Americans watching now and who rely on you, you're a voice of calm and a voice of facts in the midst of all this. What should Americans prepare themselves for in these coming couple of weeks?
Well, it's a critical time, Jim, in the next couple of weeks, because as you know, we have very intensive mitigation, the kinds of things that you've described on the show with the physical separation. If you look now, we're starting to see glimmers that is actually having some dampening effect. But that does not take away from the seriousness of what you just described on the show. We clearly are seeing cases going up. The people in New York are in a difficult situation, and what they're trying to do appropriately is to make the best of it by opening up facilities that might decompress the surge of cases that they're having. And you described it very well, and that's the reason why things like the Javits Center, getting the comfort into the harbor to be able to do that. We are still in a very difficult situation. We hope, and I believe it will happen, that we may start seeing a turnaround, but we haven't seen it yet. We're just pushing on the mitigation to hope that we do see that turnaround.
So tell us where you're seeing what you described just there as early signs. I know that New York has seen a decline in the rate of growth in new infections. What else are you seeing that gives you some hope that the curve is being flattened somewhat?
So what happens, Jim, is that it occurs in phases. If you look from day to day of the number of new cases that require hospitalization, when you're really going up exponentially, it increases from day to day. Once you start to level off, then you're going to have less people who are going to be going into intensive care. And then later on, because it always lags, you'll see a decrease in deaths. So what we're starting to see right now is just the inklings. And I don't want to put too much stock on it because you don't want to get overconfident. You just want to keep pushing on what you're doing. You're starting to see that the daily increases are not in that steep incline. They're starting to be able to possibly flatten out. I mean, again, you look at it carefully, hope it's going in the right direction, but that's what we really are trying to attain, that multi-phase component where it ultimately starts to come down.
Well, that is welcome news, and thanks so much for sharing that. I want to ask for what else helps. So if social distancing is helping, and we're beginning to see some effect of that, what about masks? Now, the president raised the prospect of recommending all Americans wear some form of mask here. Should all Americans be doing that? And to be more specific, is that about something like a bandana, et cetera? Because we already know of the shortages of medical masks, PPE masks, even for healthcare workers.
Well, Jim, the idea of getting a much more broad community-wide use of masks outside of the healthcare setting is under very active discussion at the task force. The CDC group is looking at that very carefully. The thing that has inhibited that a bit is to make sure that we don't take away the supply of masks from the healthcare workers who need them. But when we get in a situation where we have enough masks, I believe there will be some very serious consideration about more broadening this recommendation of using masks. We're not there yet, but I think we're close to coming to some determination. Because if, in fact, a person who may or may not be infected wants to prevent infecting someone else, one of the best ways to do that is with a mask. So perhaps that's the way to go. And again, I say, Jim, that's under very active consideration. We'll be discussing it today, this afternoon, at the task force meeting.
I see. And to be clear, you're saying when the supply is sufficient to allow that?
Right, because the one thing, Jim, you don't want to do, you don't want to take masks away from the healthcare providers who are in the real and present danger of getting infected. That would be the worst thing we do. If we have them covered, then you could look back and say, maybe we need to broaden this.
Yep. Speaking of broadening, if I can, from the beginning, and I know this is in the data, indicated that this was principally a disease, an infection dangerous to older people and people with pre-existing conditions. As we learn more, and you do see hospitalizations among younger patients, is that still true?
Yes, Jim. The original data from China made it seem, I think correctly, but maybe not with all the nuances, that it was like very compartmented. If you're old or if you have an underlying condition, you have a high risk of complication. If you're young, you're okay. We're starting to see that first from Europe with Italy and France, and now right here in the United States. It isn't as sharp and clean as that. We are starting to see young individuals in their 30s and their 40s who have no underlying condition that would predispose them to complications, who are getting very seriously ill, requiring intensive care. We have to keep an eye on that. It's still a minority, Jim. Overwhelmingly, it's still the elderly and those with underlying conditions. But that's one of the pleas that we make to the younger people. Yeah. Don't think that you're exempt from not only serious illness, but from the fact that you might be spreading the infection. That's why everybody's got to pitch in, everybody.
Yeah. Drug therapy treatments, I want to ask about that. Are drugs such as chloroquine, other anti-malaria drugs, is there evidence that they are working, that they're making a difference now?
You know, Jim, I've said that multiple times. When you have drugs that people have anecdotal, not proven clinical studies, people have a need, and it's understandable, of since we don't have anything, let's get it out there. But you have to hearken back to the facts, Jim. There is no definitive evidence that this works. That doesn't mean that people under certain circumstances might use compassionate use. But if you want to get back to the science and you look at the data, you need a controlled trial to be able to definitively say something works. And we have not had that with those drugs.
Understood. Looking ahead, you have said that you anticipate a second wave of this outbreak in the fall. Would you expect that to be as bad as the spike in cases as we're seeing right now?
No, Jim, if we do have a second wave, which as I mentioned publicly, I think there's a reasonably good chance we will, given the pervasiveness of this infection and its transmissibility, I don't think at all that it will be as bad because we will have several things in our favor. One, we'll obviously be better prepared. We'd have better equipment. We'd be able to deal with it better. But also we have a number of drugs that are in clinical trial, and we're pushing hard on the vaccine. So, but remember, I said a year to a year and a half. So by next winter, we may be able to even utilize that. So I think with, I can say with some confidence that if we indeed get that second wave, we will be much, much better prepared than we are right now.
And in terms of the science, will people have some immunity if they've been exposed to it, even if they're not aware that they've been exposed to it? If those are infected in a second wave, would they have immunity to getting infected again?
Yes. I mean, the people who are infected, there's no doubt in classical infectious disease that if you recover from an infection, that you will have immunity that will protect you from infection with the same particular pathogen, in this case, the coronavirus. The level of people who've been infected, I don't expect it would rise to the level to give what we call herd immunity protection. What it will mean that it will protect those who've been exposed, but at the community level, there would not have been enough infections to really have an umbrella of herd immunity.
Final question. So many people rely on you as a voice of calm in the midst of all this. So many people watching now, I'm sure they're fearful of the threat. Just a few words that you might give to the American people today as they prepare for the next couple of weeks and what's to follow.
Yeah, Jim, thank you for giving me that opportunity. We really have to hang in there and abide by the mitigation strategies. We do believe it's working. It's hard. It's not an easy thing to do. There's suffering, and there's death, and there's massive inconvenience economically and otherwise. But we're really a strong nation. We've been through some amazing things in our history. So let's all hang in there together. We will get over this, and this will end.
Dr. Fauci, thanks so much for today, but also for all the work you're doing for this country.
You've been sending flowers to me.